Hi everyone, welcome to Next Gen Tricks and Tips lab module. So we're going to be talking about the lab module today. So how to open the lab module. So under assessment/plan card, which is located here, it's under the SOAP template. You can find the lab module. So just by clicking on labs, it should open up the lab module, and once you click on it, it should look like this. So first, how to order labs. First, we need to make sure that we have a diagnosis to associate those labs with. So if you don't have an assessments, please go back to assessments and input assessments so we can associate those with the labs. So first, you click on the diagnosis. So you highlight it as shown here. Number 1, it's screening for STDs. It's highlighted blue. Then you want to make sure that the date is correct. So it always prompts to today's date. If you want to switch it, make sure you click on these to make sure you switch it for a week, 2 weeks, or whenever you want the lab to be drawn. So for future labs, make sure you change that date. The last step is you click on the labs. You can use these categories that are common by provider, common by location, or common by practice. These are pre-populated already, so these are already chosen for you. So for example, we're choosing this HIV one, so we click on it, and then this little X comes out on all of them since they are repeated between these different categories, and it should populate here under ordered labs section. So that means it was ordered successfully. So let's go back. So if you can't find a lab that is under these categories, you could always search for it. So you search here in this middle section, you just type in whatever you want to search. So for example, HIV. And one thing that happens is if you click enter on your keyboard, it will close down the lab module template. So make sure you do not hit enter. Make sure you manually click on search with your mouse. And then if you still can't find the lab you're looking for, try clicking on search full vendor compendium, and then this should give you a more extensive list. So let's talk about the categories. Like I was saying, these categories are pre-populated for now. You could always switch them. So if you click on common by provider, this box pick list will pop up, and you can switch it. For example, if you wanted OB labs to be one of those categories. So these are labs that have been designated for those different categories. So like for OB, high risk OB, Hep C labs. So there's specific labs for those categories. So you can always switch all 3 of them. You can leave them as is. You can do whatever you want with them, depending on your preference. How to delete labs. So simple. You just go into the orders lab section, which is on the bottom right corner, and you highlight the lab you want to switch, delete, and you just hit delete row, and then it should delete it. So that's easy. To update a diagnosis, sometimes that might happen. The lab might message you back or might ask that you switch the diagnosis. So if that does happen, all you have to do is first you click on the diagnosis you want it to be updated to. So for example, obesity. And then number 2 is you highlight the lab you want to update that diagnosis. And then 3 is hit this update DX, which is diagnosis. And once you click on that, it will refresh, and then it should reflect that new diagnosis that you updated. Adding favorite labs. So what you do is you go to manage my favorites, and then manage my favorites, and then it should give you a list of all the labs that are available in the lab module, and you just add it to the right hand side. You just highlight it and then add it, and you just continue doing that until you have all your favorites in there. You can always remove some, so just highlighting it and then hitting remove, and then it should remove them off your favorites list. And then you can hit close once you're done with that. Requisitioning labs through checkout. So first step is ordering it through the lab module. Step number 2 is requisitioning them through checkout. So we will want to go to checkout. So once you're in checkout, you click on it, you're in checkout. Number 2 is you want to make sure that labs is checked off. So once labs is checked off, you should see the list of labs that you have ordered today. And then after that, you just click on requisition. So that should generate a document which looks like this. So here we have lab requisition. It should reflect the labs that you have ordered, the date, time frame, and then date. Then you would want to switch this printer to the lab so you can send it out to so the lab can get the order, the requisition. If it is a future lab for like 3 months, 2 months, you could always print it and give it to the patient so they have it for their records. But you do want to requisition it. The only thing you wouldn't do for future labs is print it out. You would just leave it. You would just leave it in next-gen, in next-gen requisition like that. When the patient comes back in, there's a requisition that those labs need to be drawn. And just to note, a lab requisition is good for 6 months, and we are not to refuse old lab requisitions. That should be it. Do you have any questions or comments, concerns? If you do have other questions that you want to be answered later, you can always email us at emrtrainers@mnet.ucla.edu, and our phone extensions are there as well. Thank you. I am